for those of you that don't know, I'm Beth Helm-Smith. I am the director of the Midwives here at Women's Healthcare of Illinois, and this is my incredible team.
I'm Shauna.
I'm Jackie.
And I'm Tiffany.
And we are coming to you live tonight from our office in Mokina. We're trying to make it so that you can see us. We all have had antibody testing and everybody is negative. So therefore, we are still practicing social distancing typically and wearing masks, but we want you to be able to hear us and to be able to be part of this. So please kind of pardon us a little bit for not demonstrating that right now. We thought we'd tell you a little bit about the practice and about where we're at and where we're practicing these days, and then to answer any kind of questions that you have. We are a dedicated team of 4 nurse midwives at this point in time. We have 2 offices, both our office here in Mokina as well as our office in Evergreen Park, soon to be on the 7th floor of the building, which we're really excited about, our brand new office space. That should be opening the week of June 20th. Right now, we are on staff at both Silver Cross in New Lenox and at Advocate South Suburban in Hazel Crest. We do have the ability to take care of women throughout their entire lifespan, not just during pregnancy, but we are doing deliveries at both of those hospitals. We are working with doulas at both of those hospitals, and they are allowing doulas into the hospital and on the floor. They do request that the doula actually be a credentialed doula, but they are letting doulas in. We do VBACs at both hospitals as well. What other things would you like to tell them about us?
Well, obviously, you know about the Facebook page if you're on the Facebook Live, but we do have a Facebook page, and at the top of Women's Healthcare of Illinois, there's a groups category that you can select to be in the pregnancy group, and there's a lot of good information posted there. There are virtual tours for the hospitals since you can't go to the hospitals and tour them yourself at this point. And there's information posted about prenatal classes on there also. So that's a really good resource to have.
Mm-hmm.
I think that was one of the things that most patients definitely inquire about because of the situation that we're dealing with globally with COVID-19, to be able to see the hospital. Mm-hmm. And I think that's a great option for patients as well. So I'm glad Jackie mentioned that because that was one of the things I wanted to talk about as well.
Yeah.
Yep. Anything you want to tell people about? We also have a really fun group that records. Jackie and Dr. Beckman record typically and put up for our friends at Family First Medical, which is our family practice group that works here with us. Really, this practice is really a one-stop shop. You can come in for your entire lifespan. So Family First Medical sees groups infants all the way through the elderly. They do work collaboratively with us. They are also the group that has been pioneering and really leading the charge about community COVID testing, both for swabs and antibody screens during this pandemic. And they were really kind of groundbreaking and cutting in that before the state actually got organized and had testing sites. So there's a lot of great things going on there. They do regular full scope primary care, and then they partner with us to manage some of our patients as well. We also have full scope here in our office, meaning that you can come in as young as your teen years and when you first get your menstrual cycle, all the way through our patients who are postmenopausal. We do college-bound visits, we do annual healthcare screenings, we do birth control, we're doing full-scope birth control, including IUDs and Nexplanon placements. We work with a collaborative team of 4 DO physicians who are incredibly supportive with us, and they handle any needs that our patients have that are surgical or more complicated than what the advanced practice team can handle. Within our comfortable scope, we can collaboratively manage with our team. And then we also have Dr. Finkelstein, who was the founder of the practice, who is the leading robotic surgeon in the area. And he is continuing and now back in the OR as well, taking care of needs for patients who do require robotic surgery or urogynecologic needs. A lot of our procedures are not often done in the hospital. There are some surgeries that are done there, but our office does offer two in-office procedure suites where they can handle a lot of things here without you having to be admitted to the hospital. We also have our own ultrasound department of 3 amazing sonographers who do both gynae and OB ultrasounds for us, as well as our own lab team. So really, when you come to the office, you're coming to somewhere that, unless your insurance requires you to go somewhere else, we can pretty much do just about everything in-house.
I think that's a nice feature for a lot of patients, where you don't have to go 5 different places to get your care taken care of. So having comprehensive care is very, very essential for a lot of people, and especially during this time right now, having to go from your doctor's office, then to a lab place, then to an ultrasound or imaging location as well. So I think this is a great place to be able to have care and have comprehensive care altogether. And then to be able to see, like she said, our Family First Medical Group, if you needed to have a primary care physician, to be able to have them collaborate with us is absolutely instrumental. So,
And most of us women do not have primary care doctors that we see, so get on it.
And one of the other things that I'd like to kind of mention during this time of the pandemic, if you're not comfortable coming into the office and you still need care, you can still establish care as a new patient and do that through a telehealth visit. We have the opportunity to offer those visits. You simply would call and say, I'm not really comfortable coming in, but I'm having some issues, and we can try to do as much as we can through telehealth. There may be certain things that we do have to ask you to come in for, but there are ways that we can manage that so that you can be seen here in the office in a manner that makes you feel safe, as well as your care be effective. So lots of different options in terms of that. Does anybody have any questions that they're hoping that we could answer for you? I'm going to try and move this just a little bit so I can see if we are seeing anything. If you just want to type them in the comment section, we should be able to see them at that. There we are. We're trying to see if we can see those comments right now. Hi, Tracy. Any comments or questions? Thanks for joining us all the way from California, Miss Effie.
nice.
And yes, Effie, you can still get care here even if you're far away. Courtesy of telehealth.
I was going to say telehealth or video visits, and you can see you in person. Technology helps a lot.
It does. How about you, Willie? Any questions? Okay. It does look like if you click on the little icon button, it will actually let you add to the conversation if you want to come on screen and ask any questions.
Don't be shy.
Well, Jackie is our specialist at filming, so I'm going to hand this over to Jackie and let her take you on a tour of the office while you guys are joining us with any questions that you have.
All right. No motion sickness, anybody? Let's see if we can turn it around. So let's go to the front as if you were about to come to the office. So here is the waiting room. You would enter from the parking lot area here in the front. Here's the lobby. Lots of space so you can socially distance from each other. Check in at the front desk there. And now you're a patient that's been brought back to an office room. On the way, we pass where the lab is located in the Mokina office. And here is a patient room. There are just more rooms around the corner and a big desk where the medical assistants and providers sit. And remember, this is a one-stop shop. So you come over here and you might get your labs drawn. Some more exam rooms, but then maybe you're here for an ultrasound. How convenient. Just on the other side is your ultrasound room. And then let's say you need a non-stress test, NST, extra testing towards the end of your pregnancy. That takes place over here. So pretty cool that you can get that all done here together. I see that we have a question, but I am also trying to figure out how to read it. All right, coming back to the crew.
So we can definitely answer those for people now.
All right, coming back to the crew.
All right, now we're actually able to see your questions. So we'll try and answer some of those for you.
Coming back to the crew.
A couple of people asked if we work with high-risk pregnancies, and yes, we can collaboratively manage high-risk pregnancies with our doctor group and with the maternal fetal medicine team that we're affiliated with. We can continue to see the patients here in the office and help them throughout their prenatal care and often maintain their deliveries, but just collaboratively manage the problem. So that could be something as simple as gestational diabetes or developing chronic hypertension or pregnancy-induced hypertension or having some issues with your thyroid. Those are things that we can collaboratively manage with both our physician team and the maternal fetal medicine team in order to maintain that. And then you can still have a nurse midwife for your delivery. The same thing is true with our twins. We do see twins, and so do all of the midwives. We do go ahead and see patients who are advanced maternal age. So pretty much most of those same complications or things that you would think of that might move you into a slightly higher risk category, we can collaboratively manage. If somebody is really high risk or super preterm, then at those situations, we may have to transfer you to the physician care, and that we would do via a discussion. It's not something that just happens instantaneously. There's a collaborative discussion about what's happening and what that care plan needs to look like.
I would just want to chime in because sometimes people will ask, if I am an IVF pregnancy, I'm a high risk pregnancy, can I still see a midwife? Yes, that might put you at higher risks to become a gestational hypertensive or a gestational diabetic patient, but that doesn't mean that you couldn't see a midwife for your care just because you have an IVF pregnancy.
Exactly. So that's a really great question. There was a question about if we were doing VBACs, which yes, we are doing VBACs. When we were talking about the hospitals, we talked about that a little earlier. And yes, the midwives are the ones who are actually managing the VBACs. So that is not something that puts you into a high risk category. That means that you can't have a midwifery delivery. Actually, the midwives manage them with collaboration from our physicians, but we are typically the ones that are at the bedside managing the patients. Jalissa asked if we work at Christ, and no, right now, Jalissa, we are not on staff at Christ. We are only at Advocate South Suburban and at Silver Cross. So we are not part of the team that is seeing patients at Christ. That is typically our physician team. There was a question about Family First Medical Group, and yes, Family First Medical Group does see men. They see women, men, infants, they do the entire group of humans. That's the best way I can explain it. So
I think important to say about Family First too is we can do all our newborns with Family First too. So even once you deliver, Family First, any of the group can see your baby. So you're still in the office, still seeing the same group. So like I said, one-stop shop.
Exactly.
If your husband needs somewhere to go, you can just bring them along.
Yep. That continuity is always really nice. And it's, again, like Shauna said, that's the best way to describe it. One-stop shopping. You have your appointment once you deliver, make your appointment to see your postpartum visit, have your baby visit, and then can go home from there instead of having to come to see your midwife after you deliver and then take the baby to the pediatrician somewhere else. It's kind of nice to have that convenience. So that's always really, really nice.
For sure.
Jamie Marie, thanks for the really big shout out. We really, really appreciate it.
Nice.
We're glad that you're happy after your transfer here. And yes, our medical staff, our MAs, our front desk, our ultrasonographers, our lab techs, everybody here is really committed to making sure that this is the best experience that you can have. And we really do all care about you as a person and get to know you as a person. So your birth plan, your doula, what you need from your prenatal care is really something that we are dedicated to trying to make happen for you as best as we can, and to helping you make informed decisions and informed consent. And if something isn't going according to your birth plan or isn't able to continue the way that you would like it to, then in those situations, it's going to be an informed discussion and then go from there as to how we can retain as much of your birth plan as possible while we are not able to retain the one thing. So that is always a collaborative discussion and informed consent about all of this. Hannah wanted to know if water births are offered. We are not currently doing water births. We do have the ability to use tubs at Advocate South Suburban. We are in the process of, before COVID, we were very close to having tubs at Silver Cross, and they are resuming that process of putting those in for us, but they are not there yet. But we will be able to use hydrotherapy at both locations. We're looking forward to that being added to our repertoire over at Silver Cross. We do, prior to COVID, we did also have nitrous oxide as an availability. So once those restrictions are lifted and we're no longer concerned about the respiratory syndrome, then we expect that nitrous oxide will come back at both locations as well.
I think if we can maybe explain what hydrotherapy is for those people that may not know what that is. So it's a pain relief option for patients who may want to try less invasive pain relief, such as IV medication or an epidural. So you are submerged in water in the pool or the tub that they use to help you with pain relief while you're in labor. So that's the difference between actually birthing in water versus hydrotherapy. So for those people who are kind of confused, you're saying, oh, you have a tub, so how come I can't birth actually in there? That's the difference. So hopefully that gives some clarification.
And both locations have showers. So
and they have shower. You can also get in the shower as well, too, so that some people like the actual running of water on them as well. So you have that availability, too.
And both locations also have all of the other tools that we would normally use. They have the birth balls, they have the peanut balls, they have the ability to use the Reboza to move around, to do telemetry monitoring so that you can walk during labor. You're not consistently tied to the bed. There right now, obviously, everybody is kind of confined to their room in most hospitals to decrease your risk of exposure to COVID. But there is still ability to move and still ability to have support. All of the midwives are still coming in and providing one-on-one labor support for our patients that are trying to do natural birth. But for our patients that natural birth is not part of their birth plan, you can still have an epidural and have a midwife. That's a really big common misconception that a lot of patients have. But we do definitely, support women in their choice. And sometimes that choice is to have an epidural. For some women, that choice is to be induced because of a variety of different reasons. And we will support you in your choices. And we'll talk about what those choices are and help you to come to the one that makes the most sense for you and your pregnancy and provide you with individualized care. Did anybody else have any other questions?
I'm trying to think of other common questions that we get during.
I would say today I talked to a few patients that asked, maybe didn't meet all of the midwives, and so we take call differently than the doctors. Doctors take call for a week at a time, where the midwives take call for 24 to 72 hours at a time. So ideally, you want to meet every midwife throughout your prenatal care, so that you have a good relationship with all of them. Usually, it turns out okay. Like, there are plenty of people that never met Tiffany and had a wonderful birth with her, had the best experience ever, but I'm sure they would have liked to meet her one time throughout their prenatal care. So try to make your appointment with a different person each time. And sometimes things change because birth is unpredictable. So in the case that somebody gets called out for a birth and you don't get to meet Tiffany when you were planning on it, just plan to meet her again. We go to both offices.
Yes.
So we're at both locations.
We do go to both offices. We do also have early morning hours as early as 7:30 in the morning, and our appointments go until after 6 o'clock at night. We also have appointment hours on Saturdays. So for anybody that is interested or needs hours outside of work, we can definitely make that happen.
And partners can come to visits at this time. We ask, obviously, that they wear a mask, but if you really want your partner to come to the visit, they can. If it's an uneventful visit, maybe there's no ultrasound or it's just a routine visit and you don't bring your partner, no big deal. But if it is an ultrasound and you want them to be here, then that's fine.
Or if it is a visit that they can't come to for a reason, you can always FaceTime them and we can bring them into the visit that way. There are some prenatal visits that we also can do through telehealth. So if there is a reason that you're not comfortable coming in or something along those lines, we are finding ways to make that happen so that you can be a part of that as well.
Just today I ordered a blood pressure cuff for a patient at home and gave her some urine dipsticks so that she could go home with, and at her next visit she'll do a video visit and she's able to do that from home.
Rosa, sí, es posible por una cita en español también. Most of us do have some Spanish. We also have translators. We have had translators of multiple languages, not just Spanish. Often it's Spanish, Polish, Lithuanian. We have had some patients who are hearing impaired, and we have had translators for them. So there's a lot of different ways that we can handle language barriers, sight barriers, or other difficulties, and make sure that your care is accessible to you. We are committed to taking care of women of all ethnicities, as well as all, we have many same-sex couples who have sought infertility treatment, couples who are, surrogates.
Mm-hmm.
And as well as all age brackets. So yes, it's a very inclusive practice, and we're happy to care for all women, not just a particular group of women. And Milan asked if there's alternatives to the gestational diabetes drink. That is something that you can take up with the provider. There are some alternatives that exist. We are working with, it depends on where your lab is drawn, whether they are willing to accept any of those alternative protocols or not. But we do have ways that we can address that if that's something that you're not comfortable doing. Any other questions?
Had some really good questions. It's been
Mm-hmm.
good.
I know we're kind of new to this, so please bear with us while we're trying to figure all of this out for us. It says that we can't rotate, so sorry about that. We're not trying to make you guys dizzy.
Going along with coronavirus questions, we do not deliver patients in their home, so we're not catching
home
babies
births.
at home.
Yeah.
Home births. Patients are being tested when they get to the hospital at both hospitals, South Suburban and Silver Cross. And for those doctor patients at Christ, they are also being tested on admission. If they're an induction or a C-section, they're being tested beforehand. Partners are not being tested. And then there is room for discussion about separation of mom and baby. They're not necessarily just saying, oh gosh, you're positive, you have to separate. So there's some discussion and informed consent, whether you want to be separated or not. At the end of it all, if you do separate for 2 days, you do go home with your baby. It's not like your baby is staying in the hospital for 14 days and you can't take them home with you.
And I actually delivered with a patient the other day where she delivered before her test results were back. It was simply a question of, hey, do you know this is an option? And they politely declined, and her baby went straight skin to skin, and they initiated breastfeeding, and, everything was great. And then they went home together as always. So, anything like that you have questions about, we're more than happy to answer. Do you want to?
I'm going to check on my side to see any questions.
Okay. Do you want to tell them what you like about the two hospitals that we're delivering at?
Oh, sure. I mean, both sites have amazing nursing staff, so
Duck out of the way so Jackie can see.
both sites have amazing nursing staff. I mean, we've been really well supported at both, and the team is really helpful with your birth and your labor and getting you what you need, whether it's warm packs or extra water and ice chips and letting you walk around and move around, or music and the
I think they're used to patients doing that. Both
Yeah.
hospitals have telemetry and are willing to let a patient not be hooked up to the monitor the entire time. So
definitely.
sometimes things are new to them. They're not used to seeing maybe tons of people delivering naturally, but they're not used to it.
Yeah, we have a thing called the cubby at South Sub. It's kind of like a big blow up chair that allows you to get into different positions. And I had one patient that didn't want to sit in the bed, and we ended up sitting her on the cubby, and we delivered right like that. And she was in a great position and did what she wanted and was where she wanted. So offering that ability for people to kind of move around and be in the space that they need to be in and do what their body is telling them has been really well received. So. And you're going to get that at both hospitals, and both hospitals have amazing space and great windows and a nice big space to kind of make yourself at home while you're there, kind of during this really intimate time. So
I think one of the other things that I will pop back in and talk about is for our patients who do have to have a C-section or who are doing a repeat C-section, your partner is allowed in for the C-section still as well. And at that same point in time, both hospitals support the gentle C-sections. And so the drape is able to be dropped. The baby, you're able to see your baby immediately. Babies don't leave the room. They stay with moms. Breastfeeding's initiated very quickly. There is unless there's a reason that baby requires some extra support, everything is taking place right there in that room. And there's a lot of support right there for for those general C-sections, and there has not been any pushback to us. Again, I think that's something that they're pretty well versed in and pretty comfortable with. But at that same point, for so far this year, we're at a 91% vaginal delivery rate. So that's,
you gotta raise the roof on that one. I'm sorry. Woo!
I'm really proud of how hard everybody works to really help moms, meet their goals of having a natural delivery and being supported in that, and to, really making sure that we are staying ahead of that national average in terms of C-sections and giving people the opportunity to have a vaginal delivery, and not necessarily repeating a C-section or anything along those lines. So we're really excited about that, and really excited about the team we've partnered with in terms of physicians, our support staff here, the hospitals. It really is very inclusive for all women, and we're really excited about that. Anybody have any other questions?
Fire away.
Hold on.
As of right now, how many support people are allowed during labor? So currently it is one support person with you unless you have a certified, legitimate credential doula, that would then be allowed as well. And then whichever of the midwives is on your team. So technically one by blood, or marriage, or however you want to put that. But beyond that, it is your designated support person plus then somebody from our team. And if you hired a doula, they would be allowed as well.
And we are there too. I mean, so once you start getting active, you're 4, 5, 6 centimeters, you're starting to be more uncomfortable and you need more labor support, we are all there. One of us is there helping you labor support, getting you through parts of that part of labor. So you're not by yourself. It's not just your husband. One of us is always there with you. So.
Yeah, midwife translates to with mother, so that's kind of a nice thing too. I think that's, at least for me, I'm sure the girls share the same feelings about it, and it's during that hard core deep part of labor when it gets really, really uncomfortable for you. We're right there, whether it's holding your hand, whether it's talking you through those hard contractions, or whatever the case may be. Sometimes just knowing that your support person as well as your provider is with you through the trenches is very, very helpful. I know it was for me. And I definitely do a couple of patients who were like, Tiffany, I couldn't have done it without you being here and just letting me know that you can do this. Just hearing those words sometimes is helpful enough as well. So.
Mm-hmm. And then the other thing that I would go with in terms of that is that you still can FaceTime someone. So last week while we were laboring, somebody had their mom on FaceTime the entire time, and that was what they needed to do. So that worked for them. That's totally acceptable. We'll make this work however we need to, although physically right now we can only have that one additional support person with them. So again, it's pretty supportive at the hospital. The success rate for VBACs. So right now, our primary C-section rate and our repeat C-section rate are both equal. They were both 4.2%. Of our VBACs, we were doing quite well with that. The last time that we did stats, we were at about 84% for our success rate for our VBACs. So
raise it one more time.
Again, we'll kind of walk you through all of that. We'll walk you through who's an appropriate VBAC, what the appropriate, what those measures look like. We'll get your records. We'll talk about what labor looks like. We'll talk about support and all of that. We do not typically induce our VBACs, so that is pretty standard across the board. But that does not mean that there are not ways to kind of help you if you're going into labor and to kind of help things be augmented as well. Any other questions? You guys are asking great questions.
For sure.
We really appreciate you working with us on this technology and coming in to do this. I guess sometimes people don't really want to ask questions in this kind of a community format either. So we do offer meet and greet visits in both offices, which is an opportunity for you to come in for a visit. Tiff, come on and join us. We can't see
my little face.
We do offer those meet and greet visits where you can come in and you can sit down for a 15-minute appointment with one of the team and ask your questions. We can't give you specific medical advice during those appointments, but we can sit down with you and talk about generalities, talk about concerns, talk about things that how practice typically handles something, but we don't know you and don't have you as our specific patient right then. So there are some things like that we can't answer, but we'll do the best that we can and we'll kind of walk through questions for you. Anybody?
I'm trying to think what else people normally ask. Oh my God, I just joined, sorry.
Prenatal classes, they are offered on the Facebook group. They're posted on both Facebook pages. Prenatal classes are usually paid for on your own, but there are discounts. And most of the classes, obviously, right now are online and through the computer. They do personal classes and group classes, but that around 30 weeks would be a time when you would start to think about doing classes.
And some people are doing those a little bit earlier. We also have some prenatal fitness classes and yoga and meditation videos that people are recording and putting up for us and part of our pregnancy support group. So there's a lot of different things that we're trying to bring to you, even during this time when there's distance and people can't be a part of live classes. Lucy was asking about meals for support people. So there, you can always order from the general menu at the hospital. They typically do help with that. But the cafeteria is open and people have been, once you're in the hospital, you're not confined to the hospital. So sometimes, support people will go out and get food or go let the dog out or check on other kids, and they can still come back. So there is that back and forth allowed and questions like that.
Usually they give one meal.
Yeah, it's usually
for
one
the
meal.
partner.
And then the cafeteria and whatever you need to have delivered or pick up.
And I know both hospitals have extra meals like on the floor if it's late, or they'll have sandwiches and salads and things like that. So I always recommend bringing snacks though.
Yep, definitely. Snacks for labor.
For sure. And most of the time too, they don't kind of limit. So if for the patient who is admitted, you can always put times 2 servings of eggs or whatever on the tray too. So some people do that as well.
And then Deneen was asking about the stats on episiotomies. So that is incredibly low. I think in the entire year of 2019, there may have been 2 total of all the deliveries that we had. So very, very low. And at that point in time, it's also, if it is coming up, it's performed with previous informed consent being given. It is explained, the process is explained, and the reasoning behind the process is explained. So that's not something that would ever be done without there being informed consent.
And I would say it's never being done because it's taking too long. It's only being done because the baby is in distress and we really need to get the baby moved.
Yeah. It's very, very rare.
Yeah.
What you said, moms are tested for COVID-19 at delivery with a rapid screen, yes. Or they are tested if they're coming in for a scheduled procedure ahead of time. And then no, Milan, they are not necessarily separated from their baby. The discussion is had, and then moms can choose whether they want to be separated, whether they don't want to be separated, and moms and babies still go home together. So, but we can certainly answer any questions that anybody has about that as this goes on as well. That's the current state at both hospitals.
A really good resource of information that I usually point out to patients is evidence-based birth.
Mm-hmm.
All patients can access that online. Just type in evidence-based birth. Has a lot of good information on a lot of topics, but definitely a lot of good stuff on coronavirus also.
And if you are on our website or our Facebook page, each of the hospital's policies on coronavirus is actually posted. So you'll be able to see what the hospital's most recent policy is, so that we make sure that you're aware of any kind of updates that are happening as they change, because as we know, this has been a really challenging time and information has moved quickly and changed and been revised. And so as things continue to open and as we continue to gain knowledge, we will post any changes that come up. Hi, Carrie. And you asked if your husband will be able to be in the delivery room. And yes, you are allowed to have one designated support person with you in the delivery room. If you have a certified doula, then yes, your doula would also be able to join you, as well as the midwife that's on call. So you will definitely have support. Great. Anybody else with any questions? Any questions about gynae care or office care, or any questions about FFMG and their primary care program or their pediatric program? I want to give a big shout out to Marilyn. Hi, Marilyn. We all love your... Marilyn is the director of the unit over at Silver Cross, and we're so excited to be able to be on her unit and back in her beautiful hospital and working with her amazing team of nurses. So big shout out to you, Marilyn.
Hey, Marilyn.
Those are some great questions.
So I have a couple questions on my side. A beautiful young lady named Tiana is asking, what are some misconceptions about midwifery? Shauna, do you want to take that? What do you think? I think it's a good one.
Well, I think the biggest one is that with midwives, you don't get any pain relief.
Yeah.
I think that's the number one question I get asked, like every visit.
Or that you're delivering at home.
Oh yeah, or we're delivering at home or in your tub or your backyard. I do not like fields. It's not my thing. Yeah, so I think, pain relief, Beth said that earlier, we allow just about any form of pain relief, whether it's as simple as us being there, applying back pressure, sacral back pressure, or, all the way through the epidural, so we provide all those things. You're not limited to one, you don't have to just stick with just IV pain meds. We're going to try to encourage you to try a bunch of different pain relief. So I think with midwives, you just get a little bit more flexibility and openness to other things, movement. I don't know.
I think Beth kind of touched on it, just to also reinforce also most people, they hear midwife and they immediately think that we only deal with pregnancy. And that can't be further from the truth. We can take care of women across the lifespan. So just like your OB-GYN, they do your annual exams, your pap smears, and so forth and so on. We also take care of women through their pregnancy, which is what most people know midwives to be doing. But we also do preventative care. We take care of pregnancy prevention stuff. We do all of that. So please don't just think midwife and think pregnancy. We also, again, take care of women across the lifespan. So just in case people don't know that, you can see a midwife for your annual exams and all of the above. So
right, it's kind of like a women's health nurse practitioner,
yes.
which some of us are.
Yes, we are, by the way. So just in case,
and
midwives,
dual duty.
Yeah, we're a couple of hats, so
yeah,
it's kind of cool.
It's definitely kind of fun.
Great questions.
Did any other
Yeah.
questions on yours?
It looks like Carrie asked again, husbands or support persons are required to leave. No, that is not the case. You can stay until discharge. The husband can stay until discharged.
And they can go and come.
Yeah, come and go. We want them to be your support person. We want them there to help support you. You're going to be way more calm if you have your main support person there. And the whole goal is to reduce your anxiety and make labor a great, beautiful experience for you. Sorry, I'm having trouble reading these.
Name of the pediatrician you guys work with.
Oh, so Lucy asked about the pediatrician that we tend to work with. We tend to always refer to Family First. Dr. Beckman's group is amazing. It's Dr. Beckman, he's a DO, and then he has 2 nurse practitioners, Anne and Marissa, who are both phenomenal. And they'll see babies right after you're delivered and help with vaccination scheduling. They're open to different vaccination schedules if that's what you want to talk about. We always recommend trying to do a meet and greet with them too, just to like get to know them first as well. But they are here in the office, so
You can see them and then you can come back and see us.
definitely.
And then we also do offer a new mom visit, which is different than your 6-week postpartum visit. So I'll let Jackie talk about that a little bit and what we cover.
What do you mean?
So that first, like 7
That
to
first
10 day
Postpartum.
visit.
Oh, sorry. Yes, I know about these.
We got to update her every once in a while.
Right, because most of us
She's
are
had a long day.
most of us are used to doing 6-week postpartum visits, but at the end of pregnancy, you've seen us a ton, weekly, especially right at the end. And then you have your baby and we don't see you for 6 weeks, which is crazy. So we like to check in on you at a week to 2 weeks to see how you're doing breastfeeding. How are you doing mentally?
Are you
Everything.
sleeping? Are
Yeah.
you eating? How's your cramping and bleeding doing?
Yeah, how's everything going? And so some patients have chosen to do that visit via video visit, which is totally fine and acceptable. Some of our first-time moms have come to the office because they really need some breastfeeding help. And so they bring their little one in and we truly sit down with you for 30 minutes and even an hour sometimes and really help you breastfeed your baby and talk about latching, supply issues, any concerns or complaints that you might have.
Sore boobs.
Yeah.
Milk supplies low.
And the beauty, if you're
Shauna
seeing,
breastfed twins, so you can always see Shauna if you need some expert advice.
and the beauty is if you're seeing, Dr. Beckman or one of the nurse practitioners with him and you have an issue and he brings up an issue and you're like, oh, wait, I'm having trouble breastfeeding. They can easily come get us and we could come right over and see you and work from there. We work you right into the schedule as you're here. So breastfeeding issues hopefully aren't an issue for very long once we have it.
Right. We never want you to just be at home struggling. Trying
Right.
to reach lactation at the hospital, and that's not working. And then you're like, gosh, I'm not coming to see them for 6 weeks. Or people don't even think that they can ask us about breastfeeding. But we're more than happy to discuss any breastfeeding questions that you might have.
And we do have a whole team of resources at our fingertips that we share and we can share with you. So if you do need ongoing lactation support, we do have some lactation consultants who will do video visits with you. We have some who are doing house calls. We have nighttime doulas who can come to your home and help out.
Definitely.
We have a whole different variety of resources. We have chiropractors that work with us who can help with adjustments to help with low back pain or other things. We have a variety of different resources that we work with. So don't ever hesitate to ask any of those questions. And also, one of us is on call 24 hours a day. So we are taking phone calls from patients for emergencies. And we do return phone calls. There's also an email address or Facebook. You can message us and somebody will get back to you within a 24-hour period and answer those questions for you as well. So please don't ever hesitate to ask any questions you might have.
A couple more questions and a shout out from Haley. She was one of our patients. She delivered with us. Best group of women ever, she says. We think Haley's the best ever. Lucy asked, how long is a stay at the hospital after a baby is born? So 24 to 48 hours for a vaginal birth, 48 to 72 for a C-section, but it kind of depends on everything. It depends on what your delivery was like, what time of the day you delivered. if you want to leave at 24 hours, but 24 hours is 1 a.m., you might not leave at 1 a.m. Alternatively, if your baby's bilirubin is elevated, you might want to stay a little bit longer because it might sound awesome to leave the hospital as fast as possible, but then you see your pediatrician the next day and they want to readmit your baby, gosh forbid. So sometimes being there an extra night isn't so bad. So that's ideal, but we do try to get people out as quickly as possible if nothing is going on to limit the stay in the hospital.
Definitely.
I have a question on this side. At what age should I start seeing you guys? And I'm assuming this young lady is asking about seeing for gynae or female health. So again, as female providers, we see young ladies across the lifespan. So you don't necessarily have to be sexually active to come and see us, but you can talk about, so say for example, a young lady is having maybe really bad dysmenorrhea, which is periods. My daughter used to call hers Daryl because it was horrible. So that was what she named her period. So if she's having that issue, and perhaps we can manage that with some techniques with maybe oral contraception. And some people hear contraception and they think, oh, but I'm not sexually active, I don't need to be on birth control, but we can use that for other methods. So I've seen patients as young as 13, 14, something like that. It's probably the youngest that I've had. And depending on what their needs are, and you have some young ladies that may be experimenting with the opposite sex or just sexually active. I won't even say the opposite sex, just maybe just
or
being
same
sex, whatever. Just being, let me just say it like this, generally, just being sexually active. And they may need to have that conversation, and their parents are wanting them to speak to a provider. So the ages are getting younger and younger nowadays. So, and they may not feel comfortable talking to a male, and they may feel more comfortable talking to a female, something like that. So I can take them as young as when their parents feel it's comfortable, and they can come in with their parent if they feel comfortable doing so.
And some people do come in early to talk about what it's like to get your first period. What does that look like? What does it look like, when your period starts and stops? Because sometimes that happens. Or what happens if all of your friends have gotten their period and you're 17 and you haven't started? Is that normal? So we can work with you to answer all of those kinds of questions. We can work with you during your general annual exams. The oldest patient I have had was in her 90s, and she has followed me for a long time, but she comes to see me from the lovely nursing home that she lives in. And not during COVID, but, so it's really about being with women for their entire lifetime. It's about doing things to make you comfortable and knowledgeable about your own body and educating you about what that looks like, and what that means for you.
For sure.
Another question, kind of the same question we've already had. What is our stance on VBAC from Brittany? And so both hospitals, South Suburban and Silver Cross, again, are VBAC friendly. Beth mentioned earlier that our successful VBAC rate was maybe around 85%.
About 82.
Something like that. So definitely a patient-provider discussion because every patient is different and every scenario is different. They are allowing VBACs only after one C-section. I will say both hospitals, I think, will not allow a VBAC after 2 C-sections. So,
but that also should be a discussion, because say you've had 2 C-sections and you've already had a successful VBAC, that certainly is something that's going to be taken into consideration and we're going to talk about. So don't think that you're just automatically once a C-section, always a C-section. There's a lot of room for discussion and that in this practice.
Gina asked a good question. We talked about meeting all the midwives at all your visits, but gosh forbid, if you have not met all the midwives and it's labor and delivery time, will the midwife on call know your chart? Of course.
Absolutely.
God. We're always stalking you out.
Yes.
Electronic medical records are a beautiful thing. So
we can always look you up, from wherever we are. Like, let's say you've never met Tiffany or I, but then Tiffany's there for your labor, so she could look you up very quickly if she's never met you before. But chances are that at some point we've discussed
talked,
the patients that are coming up due anytime soon. Oh, did you know, so-and-so is due.
That's definitely something that I'm very big about all of us having, is ongoing conversations and ongoing opportunities to discuss. So we pass along critical information like, Sally wants to be induced on Friday because, her husband's being shipped out and she needs to have this baby. That would be definitely something that would be talked about by the team, and we would all be aware of. We also would be aware of, different issues that you have, different fears you have.
Mm-hmm.
If you had a previous bad experience, if something, didn't sit right with you, those kinds of critical information are passed along between all of the providers. We kind of all drive our families crazy because of the amount of time that we spend talking to each other.
Mm-hmm.
I mean, like, we're kind of always
Sister
in
wives.
conversation.
Yeah.
So there's definitely going to be a lot of communication, and everybody will know what's going on with you, and that gets shared amongst just this team. Now, that being said, your privacy is obviously protected, and your
absolutely.
HIPAA is protected.
Absolutely.
But between us, we are communicating so that we're sure that your needs are being met.
For sure.
Definitely.
That's it from my end. No more questions over here.
Let's see if we have any on this side.
Anybody else have anything that they want to ask?
Any other concerns? I know we had a lot going on globally, nationally, and locally over the last couple of days. And I myself personally was not in the best mental mood. So mental health is definitely something that we have to be cognizant of as providers. And we also have a great psychotherapist here in our office, so that's something we also, and it can be a very sensitive subject, even without the most recent events that have been occurring. So women who deliver, sometimes that transition after the normal postpartum blues session, and then it's still dragging on. So some women have a hard time maybe admitting those kinds of things, and it's important for people to be open and not afraid to discuss those things at all. So we're definitely are very open to listening to your concerns about that. And I definitely know that I am. I know when I first got home with my beautiful baby, who I tell everybody she was kind of crazy when she first got home, and I didn't know what to do. And I was like, I'm a terrible mother, and oh my God. And I was a labor and delivery nurse, and I used to sit in the nursery and take care of like 15 babies. And then I got home with my own, and I was like, okay, she is not from this planet. I don't know what to do with her. Why is she crying? And, and started having my own meltdown and had to call my mom, who was in Chicago. Was like, okay, well, I don't know. My neighbors probably think I'm like beating her up or something. Like, it was terrible. So, this is definitely something that's real and evident. And so, I just tell moms all the time when they come in, just to make sure that they really, really are okay. Sometimes they like to just say, nod and yes and say I'm okay, when truly they really, really aren't, because they're afraid that we're going to take their babies from them, or, put them in some kind of institution or something like that. But there definitely are resources out there. So we do have those available too. So.
And with that, if you ever feel like you need more than the normal amount of visits, like if you come in for a 2-week postpartum and a 6-week, but somewhere in there you need another visit, or, you need a 9-week postpartum visit.
Or a 2-day of visit.
Yeah.
2 days, you've gotten home and you're like, ah!
Even if you're still pregnant and you're like, gosh, I just don't feel right and I want to come in, but I was just there 3 days ago. Yeah. All of those things are acceptable. You can always come and see us
as much as you want to.
Yeah. Those particular extra visits are something that if you've had a previous loss, you may need extra reassurance during this pregnancy. You may need extra reassurance around the time of the loss, or until you're feeling the baby move, or maybe this is a pregnancy that you're not so sure about. Maybe you're not 100% certain that you're thrilled to be pregnant and that you're having some issues with it. Those are also points in time that, there's friendly ears here that are happy to listen to where you're at. Mm-hmm. Sometimes it's life transitions. Sometimes it's relationship issues. You're worried about issues with infidelity. You're worried about issues with perimenopausal change or body changes, or your weight is not something that you're not really particularly happy with. There's a lot of different things that as women you deal with that add to both your physical and your mental health. And we are here to definitely support you through all of that. Dr. Kathy Slagaki, who is our medical director, actually is certified in obesity medicine. And so if the weight is something that you're struggling with, that is adding not only to your physical concerns or your mental concerns, she's somebody that we can set you up with a special visit with as well, just to make sure that you have the care that you need if you're motivated to make a life change at that point.
I'm sorry, I missed a question from Milan. She asked, what is our stance on delayed cord clamping? And I think we can speak for all of us that we're very into it.
We're all about it.
In fact, you'll probably hear in the room that other providers or pediatricians will be like, are you cutting the cord?
We're like,
And
no.
We're like, no, kind of not.
We still got time.
It's to the point now where like the nurses will like kind of, they don't even tell us the time until like we're at over 2 minutes. They'll kind of tell you that. Often with that comes up the question as well is if you can do delayed cord clamping and still do cord blood banking. And yes, you can do both. There is a way to make that happen. It's just something that we need to know about ahead of time so that we can make those plans. But yes, you can do both. And yes, we do support you if that's a choice. Yes, you can still take your placenta if you are doing placenta encapsulation. Even during the time of COVID, there's a waiver you sign and you can still take your placenta. And yes, we do have people that we can refer you to that we know are safe processing placentas if that's something that you want to do.
So for those two things, I would say for placentas and for cord blood banking, just remember those are things you have to do before you come to the hospital, or you plan for those things ahead of time before you come in.
And just speaking about cord blood banking and along those lines, I have had a few patients that were asking about Lotus Births, and unfortunately, I don't think I've asked Silver Cross, but I know for a fact that South Sub, that's not something that either of the hospitals have a means to be able to safely do that at this point in time. So hopefully we'll get there at some point, but right now we don't have a means to be able to do that. So, and for those who may not know what a Lotus birth is, that's actually leaving the placenta and everything still attached to the baby after it's born. So
I like to tell, going back just a little bit, I like to tell all my patients that I meet from the first time, we give you a schedule. If it's OB, this is when we'd like to see you.
Oh, yeah.
You know, it's a bare minimum of what we want to see you, and that's your schedule. But our doors are open. So, you know, you can see us as much or as little as you want based on the schedule. So we can always see you.
We were asked another question about whether you can still have cramping or phantom cramps after your delivery several months out. And yes, your uterus took 10 months to get back to get to that pregnancy state. It doesn't go back to its pre-pregnancy state within the first couple of days. That can take quite a bit of time. Plus your body stretches and organs move. Your bones have relaxin and cartilage changes. So there's a lot of different things that definitely affect that. And you might have a diastasis and need to follow up with a physical therapist or pelvic floor changes. So there are a lot of different things that can affect the postpartum period. And again, that's something that we'd be happy to sit down and have a conversation with you about so that we can determine how to best help you and whether that's something that we do or whether it's something that we refer you to one of our great colleagues to be able to help you best with.
So I have a couple questions on this side. So patient asks, can low-income families utilize the midwifery services? And I'm assuming that you mean patients who may have a different insurance that may not have what's the word I'm looking for, like a corporate insurance like Aetna or Blue Cross Blue Shield or something like that. So we do accept certain medical cards, for example. We take Blue Cross Blue Shield Community and Meridian. So
we also take many HMOs.
Medium HMOs, if that's something that some patients do have also. So hopefully that answers your question. And then
And we have self-pay options as well for patients who require a different option, who may during this time have lost their insurance due to not working. And, we can work with you and facilitate those things through our billing department. We would refer you to them, and they're amazing at helping you out.
And then one other question somebody asked, which is actually a really good question. This might be a little more detailed, but how have new moms been supported in postpartum, especially during this season of COVID, living through a quarantine, extra resources, telehealth, et cetera? We kind of touched base on this a little bit, Devon, which I appreciate you for the question. So we do offer, and I know you chimed in a little bit afterwards, but we do offer telehealth, and we do what we call video visits as well. So depending on the scenario and what the reason for their need to see a provider. So we can screen video telehealth, and then video visits if it's appropriate. If it's deemed that they need to come in, patients are screened necessarily, and then if they need to come in, we'll have to schedule them for an appointment. But most of the time it can be handled via telehealth or video visit. So thank you for that.
Mm-hmm. And we can always order blood pressure cuffs for patients if they want to stay at home and not come into the office for certain scenarios, especially postpartum. Like if you want to take your blood pressure and weight at home and do a video visit and not come to the office. If you don't need a physical exam, then that's okay and acceptable too.
Yep, we'll work with you on it. Anyone else with any questions? Hi,
Yes.
Karen. We're happy you chimed in. Thanks for coming.
You guys have been great.
You guys are making this so easy for us.
Love the
I can't wait to
interaction.
see you in the office.
Schedule your
Hi,
appointment.
Nina.
For those
Remember,
who-
we'll look like this, so you'll know what we
right.
look like. When
Put our
we're
mask on.
covered up.
I will be like this.
We can all. Any other questions that anyone has for us?
Thanks to everybody for
Yes, thank
joining
you.
and asking questions.
And
Let's see, we got our cards.
And please don't forget that you can go ahead and email us or call us with any questions that you have, or put them through on the Facebook page here. We'd be happy. We have a team that will definitely help us in making sure that those messages get to us and that you get a prompt reply. So we really appreciate all of you.
And we remember you all because
Yes.
look at Shauna's face,
Jasmine.
just smiling from
Mwah, mwah,
Jasmine.
Love
You can always
it.
bring
Need
your
to see
baby
that
in for
baby.
postpartum.
Oh, I want to see that baby. I loved her birth. Oh my gosh. Love, love, love.
Please feel free to go ahead and, if you're part of the pregnancy group too, feel free to post those pictures of those babies.
Yeah.
Everybody really wants to share in your joy, and definitely, send us all of those kinds of things.
Karen just asked.
Yes, Karen, we definitely do meet and greets. We talked about that a little bit earlier. So if you have more questions or specific questions that we haven't answered tonight, you can always come in for a 15-minute appointment with us so that we can go over those with you.
And what Beth was saying, if you delivered and you had a great experience and you want to share it, if you don't feel comfortable sharing it on the Women's Healthcare of Illinois Facebook page, you could share it on the pregnancy group or both. It's nice to hear good things too.
And there's also a spot where you can join us on our website, and you can submit pictures there, or you can submit a review. Reviews are always appreciated. Both, and we love to hear your good comments, but if there's something that you feel that needed to be improved for your particular visit or something like that, please don't hesitate to bring that to one of our attention so that we can address it. It may simply be a few questions, or it may be, that you weren't sure about a procedure. We want to hear the good and the bad so that we can, make this the best experience it possibly can be for you.
For sure. Thanks, Gina, and hi, Rachel.
Hi, Rach.
Hey, love you too.